Welcome back to the Vitality Vision podcast. I'm your host, Greg Bennett, and I'm joined by David Vogel, the CEO of Voloridge Health, and Barry Miller, the president of Voloridge Health. And today we have a very special guest with Amy Mack, who's the CEO of the Institute of Functional Medicine, otherwise known as IFM. And today we're going to be talking about her background, what functional medicine is, what the Institute of Functional Medicine does. We're going to be looking at the world of healthcare, and basically having a conversation with Amy about the future of health in America and maybe what physicians and clinicians should be looking at. Looking forward to this conversation. I hope you enjoy it as much as we do. Cheers. She's flown all the way in from the other corner of the US, from Seattle, to come and join us today. So a big thank you for joining us and welcome in studio. It's so exciting to have you here.
Oh, thank you so much. I'm so glad to be here with all of you.
Yeah, thank you. And Barry and David, good to have you guys back in studio, David, after all your travels.
Good to be here, as always.
Yeah, it's good to be here. And thank you for bringing a tinge of fall. This is the first lack of humidity we've had since the fall season began, which officially doesn't start in Florida till December, but you brought it early for us.
Yeah. I was happy to do that.
I was just saying to Amy this morning at breakfast, I find Florida weather in September and October is my least favorite. Can I just say that?
September's the worst month, I think.
Yeah.
Because you want the fall, like coolness, or at least lack of humidity or reduction to come back, and it never happens.
Yeah, but it's just
October,
windy,
November.
wet. I'm only complaining because my tennis has been, I haven't been able to play tennis, golf, the siren keeps going off.
It's hurricane season. It's the heart of hurricane season.
Yeah.
I know. Well, no hurricanes, touch wood, but we're all good to go. But Amy, let's hear a little bit more about you. We had a wonderful breakfast this morning. It was great to have a chat. Mm-hmm. But your background is incredible. Let's rewind the clock a little bit and just tell us, how did you get to where you are now as the CEO of IFM?
I love that question. And I really like it because I think sometimes we believe that this trajectory is like, I learned this in school, I will do this the rest of my life. That has not been my trajectory at all. When I went to college, I was really focused on maybe being a physical therapist. I was then going to be a journalist, and I wasn't finding my place until I touched on the environment, which is a nice connection to the foundation. But that work sort of catapulted me into biology and environmental science and public affairs and policy. And as I was coming out of graduate school, which was a really difficult time to be getting hired, I ended up in this neat opportunity to be in city government. And that's kind of where I really learned about what mattered to me, which was finding ways to empower people to take back whatever that goal is, whatever that thing is they're trying to achieve. So in city government, it was about working with communities to take back their community, to rid the community of crime, to bring back safe streets. And then as I got into federal government work, it was about how to empower nonprofits to really be able to function at the highest level and drive volunteerism, which was this interesting connection to health that I wasn't really taking in at the time, but later I would learn how important it was. And then my husband is a lifelong academic guy. He's a regenerative medicine scientist. And so we were on this sort of travel around the country, postdoc, a second postdoc. And so I had this really exciting opportunity to come into new communities and really learn the community and try to figure out where my place was there. And I worked hard on that. So that led me to youth development in the nonprofit space. I was with two different Big Brothers Big Sisters affiliates, both in Winston-Salem, North Carolina, and then in Seattle. And that's when I really started to understand what it meant to be a nonprofit leader, to drive and strive for kids at the time, to help them to understand that there was a place for them in this world. And I was really just, looking online, and I got this ping about this Institute for Functional Medicine. I was like, what is that? And it was a recruiter saying, hey, we're interested in you coming in and interviewing for the job. And I was like, I don't know what functional medicine is. And he said, that's okay. they're actually looking for a nonprofit leader to bring a mission focus to a really business-oriented organization. And little did I know that I think this trajectory through all of these different careers was leading me to this space. And what I've been able to really be a part of at IFM is empowering people as a clinician to take back their career and as a patient to take back their health. So this empowerment idea has been the thread through the last, well, I just turned 58, so the last 30 or so years.
Wow.
That's
The
awesome.
word empowerment's in our mission as well. So
Yeah, I love that.
Yeah. So was it, you're saying there was no medical background even in your family's history or like?
Well, my dad was a gastroenterologist. So there was some...
So how does that play? It's a little different. Yeah.
Well, it is interesting. You know, I grew up in a family where our dad was really our doctor, even though that wasn't really the way it was supposed to be, right? We didn't see a doctor very often. He just, you know, kind of put a Band-Aid on the knee and popped us back to school. But I watched him over the years growing up, you know, start his own practice, scale his own practice, be both the president of his practice and take care of patients. And that taking care of patients was where his heart really sang. I watched what insurance did to him as a practitioner and how frustrating it was. I watched him take night call for the, you know, bleeder that had maybe not had as good of a lifestyle approach, and how he cared for every patient in the same way. I worked in his office, and there was this one particular file cabinet that was the insurance-only patients. And then there was another file cabinet, and it was probably, there were these cards, and there were, I don't know, 100 cards in there. They had this rubber band around them, and after he died, what I learned about that was that those were the patients that couldn't pay. And he took care of them anyway.
Wow, that's cool.
And so, you know, it's like what I learned was what the healing part of medicine really is, which was him.
Yeah. So this is personal for you. It's, I mean, you've had a front row seat of seeing the medical profession, you know, up front and personal in a very, you know, experiential way, you know, your daily life, family, seeing your family and how your father interacted or evolved in the health field. So that's, I'm sure that's got a lot of meaning to you, and probably, you know, was part of the influence or catalyst for you to get into this field, and probably something that you think about often. So thank you for sharing that. That's a touching story to hear about that, and so important.
I'm happy to share it. I do. There is a whole family component that wraps around what it means to be a practitioner. You know, my mom, we ate dinner together at 9 o'clock at night because that's when he got home. You know, that's how it was. As I was taking on this role, my dad had just been diagnosed with Alzheimer's, which was awful. And I became CEO of IFM on what would have been his birthday, and he had died just a few months before. And so I feel like I get to carry out him every day.
Yeah.
Very cool.
It's pretty neat.
And so this move to the CEO of IFM, how different is that from, say, working with the nonprofits and government that you did prior? Has it been a massive change for you, or is there a lot of similarities?
There's a lot of similarities in one sense. You know, I came from nonprofits where all of the money really came from raising money, auctions, you know. I would sign piles of letters for individual donations. We made calls on banks and every other community business to really make those organizations run. At IFM, what we do is produce education. So the way that we really operate primarily is through the funds that we raise from people that come to our programs, which sometimes can feel like, wow, that's not actually what a nonprofit is. But the reality is, at the end of the day, everybody that comes to IFM to work is there to drive the mission. They all believe in empowering somebody to take back their health. They believe in setting goals and helping individuals to succeed. They believe in what the clinician is trying to do, what the clinician wants to do, and they understand how hard it is for them to do it. So the mission part of it, it's there in every single person that works in the organization. How we get to do our job is just a little bit different.
Yeah.
I mean, it's business.
Yeah, it's a business.
Yeah.
How much of functional medicine is covered by insurance, and for what's not, like what's available for people who can or can't pay for it?
Yeah, it's a really great question, and it's a question that we are spending a lot of energy on right now. In its purest form, very little is covered by insurance. And that can feel daunting, and it can also make someone say, well, why the heck would I even try for this education? It's a lot of work. The reality is that we have more and more clinicians that are coming to our programs that actually are working in large institutions. They're working in primary care, and they are bringing the foundational units of functional medicine to their 15-minute appointment. They're starting with, what are you eating? How, do you actually not exercise?
Move.
Do you move? Do you move? We talked about that this morning. Do you move? How are you sleeping? The basic fundamentals of lifestyle and lifestyle modification. So in those instances, functional medicine is being woven into a conventional setting, which I think is the exact way that we'd like to see it happening across the board. It's getting covered there because it's not sort of, here's functional medicine, cover functional medicine. It's this is actually a way for me to evaluate your health, figure out the root cause of what's happening in your health, and really find a way to personalize and correct the dysfunction.
So can we ask Amy to define functional medicine?
Yeah, I was going to say, let's step back let's define functional medicine, and then the next part to that will be define what the Institute of Functional Medicine does to support functional medicine. I feel like we're all fairly familiar with it. My wife and I, we see functional medicine doctors, blah, blah, blah. But it's still I was doing some homework before the show. It's a fairly small little world, growing,
right?
And hopefully keeps growing with your leadership. But it's still, so tell people about what does a functional medicine physician do or clinician?
Right. So I love this question about what is functional medicine, and I sometimes like to start with what it's not, if that's okay.
Yeah.
Because I think there's a large misconception out there. Functional medicine is not fancy labs. Functional medicine is not nutraceuticals and supplements. Functional medicine is not, red lights and cold plunges. I love the cold plunge story. I did listen to that.
She's referring to Barry almost killing himself by trying to clean his cold plunge. If you
I almost killed myself.
What episode was that? We have to go back and find out what episode that was.
I listened to it. Those are tools. Those are pieces of what it takes to practice functional medicine. But at its core, functional medicine looks at the root causes of disease. It identifies the root causes of disease, and then it aims to address those root causes through a therapeutic approach that's worked on with the practitioner and the patient together. It focuses on what the patient actually wants to do, is willing to do, and helps them to achieve their goal. And the reason I start with the what it's not is because I think all of conventional medicine, and really so many things in our life, we try to shortcut to get to the answer. We try to shortcut to get to the solution. And conventional medicine, there's so much important work that happens in conventional medicine, but conventional medicine supported with a functional medicine angle, where what's happening there is figuring out with tools like what you were talking about at Voloridge Health, why is that diagnosis what it is? How can we figure out what treatment plan will work to address that dysfunction or address that imbalance? And how can we put you on the path to health?
It kind of makes sense. like why
not do it
why
this
isn't
way?
everybody like to me? It's like when I looked at the statistics this morning, and you can tell me if I'm wrong or right, but there's like 1 million plus physicians, doctors in the US, and 2,500, 3,000 functional medicine certified practitioners, and you kind of go, I don't know. I sit here as a cynical Australian and poking fingers at everyone, but it's almost like, how is this not incorporated into anybody that's wanting to be a doctor? Does that frustrate you? Do you look at that and go, how is that not the way we're approaching medicine at its core?
So it does frustrate me in a sense, but I'm a glass half full gal. So for me, it's like, oh my gosh, such rich territory, right?
Yeah.
Like, look at all of these people.
It's a target-rich
Yeah,
environment.
yeah.
Totally. It's
Yeah.
a totally target-rich environment. So for me, it's invigorating. I think what feels harder is that there are 1 million practitioners, right? We need everyone to be learning pieces of it. We need clinician types, not just MDs and DOs and NDs and NPs, but we need the 20 plus that are part of our program to be learning some of the basics of functional medicine, even if they're just bringing portions of how to identify and address those imbalances. And again, you can start with the tests. It's helpful, but not everybody can afford those. And not everybody can afford the supplements. So if we really sort of go to the core of what it is that we're doing, the goal has to be, how can we identify the things that are really necessary for us to address, and how can we do that maybe first and foremost without the lab work, but simply by asking those couple questions, what are you eating and how are you moving?
So I'm sorry to hog the mic
okay.
with question. I got so many more. Can I do one more and then you jump in, Barry, because I can see him itching. But okay, so these 1 million practitioners that we have, what's the process? They come to the Institute of Functional Medicine. You have educational courses. They become certified in that. And who are those practitioners? We were talking about at coffee this morning, chiropractors to doctors. But who can come and become certified, and what's that whole process like? Is it expensive? Is it hard?
So we have about 20 different licensures that come to our programs and go through certification. Anybody can come to our programs. Anybody who wants to. We have patients that come that just want to learn, but it's primarily practitioners. If you break it down, it's about 45 to 50% MDs and DOs. The next largest group, interestingly enough, is nurse practitioners. So, and then it's sort of like nurse practitioners, nutritionists, and then it starts to sort of be in the single percentages. We do have chiropractors, we do have pharmacists, acupuncturists, dentists, big growing area.
Interesting.
I mean, think about it. Everything we take in, right, goes through our mouth. So that profession actually is probably one of our most largely growing groups. They go through our programs. There's 7 courses, a foundational course, and then 6 modules that address different parts of the functional medicine matrix. So there's GI, cardio, immune, environmental health, bio-E, and hormone. So really looking at different aspects. You could line them up against your priorities, right? Looking at different aspects and where you might see the greatest chance for addressing imbalances across those. They take all those programs and then they sit for an exam, and we just are launching a new certification program. We are evolving away from our current program where we have about 3,000. Those people will all be transitioned into the new program. The new program is competency-based. So it really is focused on, this is the skill set that you need to practice functional medicine within your licensure. And to answer your question, it is expensive. And I think that's an area, we have a scholarship program. We've received some funding from the Volo Foundation, which we're incredibly grateful for. But we need to be moving as many people through that as quickly as we can. And right now, with the sort of lots of transitions happening in healthcare, training dollars go away fast. So what we're working to do is make our programs as available as possible in a format that meets the practitioner where they are, and try to make it as easy for them to learn as possible.
I'm wondering how much of functional medicine is working with patients who have symptoms and are you trying to get to the underlying cause versus healthy patients who just want to be healthier.
You know, I don't know an exact number, but I would say it could be as much as 50-50, right? We call that the health activated consumer and the chronically ill.
Right. I guess I probably shouldn't have said healthy, maybe asymptomatic.
Asymptomatic.
Not always healthy, right?
Right,
Okay.
right.
What is healthy?
Right. They haven't gone through all of your tests. I think, you know, we see both. We absolutely see both, and that kind of wellness area is a growing area within all of healthcare, which really sort of strikes the chord of empowerment, right? Sure. I want to take the best care of myself that I possibly can. So I don't know the exact percentage, but 50-50, I would guess.
There's, I guess, for some, there's supplementation that can help. Do you ever get like frustrated with maybe how thin the research is and whether, you know, trying to quantify whether or not a supplement will help? Because it's just something I battle even in my personal, you know, I take a lot of supplements, but the research is so thin, it's probably a small percentage of them that actually work. What are your thoughts on all that?
Well, I, as the non-clinician, I would say I think the evidence is thin. I agree with that. I think the bigger challenge actually is the quality of the supplement. Yeah. And again, then you start to talk about expense, right? As we think about where functional medicine is as a discipline, one of the things that has happened over the last couple of years is functional medicine and its recognition has grown on TikTok, right? Mm-hmm. Everybody was so excited because there were so many hits on TikTok for functional medicine. And I was like, oh, that's terrifying. We should all be terrified that that's happening. Because at the end of the day, if you listen to what most of those are, it's somebody who has decided this supplement's going to solve all problems, or these 4 supplements are going to solve all problems. And they don't, functional medicine is about personalizing and understanding it for the individual. It's where the biggest challenge is in the evidence, right? Not everybody metabolizes the same way. Not everybody has diabetes for the same reason. Not everybody is having a cardiometabolic issue for the same reason. So we can't assume that the supplement's going to work the same way. Supplementation, critically important. It stabilizes the patient. It helps them to achieve their goal. Long term, the goal has to be, how are you moving your life forward? How are you changing the eating patterns so that they meet the needs of your body?
It's very individual. It's funny, can I just,
yeah, sure.
And then I'm going to pass it over to you, but it was funny you just mentioned like it's so individual. Our last episode, we just broke down, you know, that we often say A1C is the number one thing, then that's it matters for type 2 diabetes. And we actually just took a deep dive with David on the data and we looked at 28,000 people that had an A1C of 5.7. But why did some get diabetes and some didn't, and broke down all those by fascinating research to look at the individual, to your point, and the holistic approach. But,
So I wanted to go back to, you mentioned that there's 20 different licenses, different profiles of folks. What's the time span for them to become members and licensed with your organization? Does that vary quite a bit amongst those 20 licenses? And what would you say is kind of min-max for, if you're a physician, would you say, oh, this is a year-long process, 2 years? What's the typical?
So a couple things. I'll just address license because you mentioned it. So someone comes in with a license, what we're doing is certifying. We don't change the scope of their license. And it's a really important thing that I say over and over and over. We are not changing the scope of your license. By you becoming functional medicine certified, it does not mean that you can do things that you weren't able to do before. It's just that you have more knowledge to do the things that you should know, right? Time span is really self-driven. So we offer our programs, our foundational programs offered 3 times a year. Our 6 modules are offered just 1 time a year each. And those are in a cohort model, so somebody can take it over a period of 45 days. Some people try to do it all in 1 year. We would not advise that. It's a lot of information. And actually, taking the foundational course, taking a few courses, applying it in your practice on a daily basis, that's where you start to really learn. We do have people that take it over a long period of time and actually never certify, but they're practicing. And that may be enough for them. The credential might not be important to them. But on average, I'd say it's somewhere between 2 and 3 years. And those individuals, when they finish, they have something that actually says, I'm competent in these skills. It's worthwhile to look for somebody who has taken programs, who has gone through certification, because that does give you the real idea of how much they've learned.
Well, quick follow-up. When you think about the folks that go through your program, and in particular, I suppose it makes sense to maybe think about physicians and perhaps nurses. Is there a big challenge aside from the time commitment? Is there a big challenge, would you say, either mind shift or like a paradigm shift in how they need to think about practicing medicine that is difficult for many of them?
I think yes. The answer is unequivocally yes. But what we find most of all is somebody that really it resonates with them. They actually say, this is actually what I came to do in my profession. I haven't been able to do it. So I get to look my patient in the eye and I get to help them achieve what they're trying to achieve instead of saying, here's a pill. And so is it hard? Yes. And they all say that. This is hard stuff because it is retraining how they think, how they approach, what the engagement is with the patient. And that can be hard for someone to do, but they find it really rewarding.
But they volunteered. They're already probably on the process of wanting to. Because from what I've heard, and I don't want to speak out of turn here, I'm just hearing things on TikTok or Instagram. So nobody take what Greg says to be sure. But it's like to become a doctor and get your medical license, you do 1 week of nutrition. I mean, have you guys heard that? Am I making that up? That's kind of, when I heard that one, I was like, that's kind of a big deal. Like what we put into our bodies every single day that we, anyway, I don't want to hammer doctors. I'm just saying I was surprised.
Can I ask one more quick follow-up just to really think about the profile of people? I think we got a pretty good handle on and what it takes to, kind of go through this transition, at least at a high level. Is there a typical, and I know typical questions like this are hard to answer, but is there a conventional where you'd say it's generally a clinician that's been in practice for 5 years, 10 years? Is there some point where you go, here's the fork in the road where many people are, that are joining us are saying, okay, I reached this point. Are there some characteristics, either time-based or other factors that, you'd say these are the people that what our message is resonating the most with that are, finding interest in what we're doing?
It's a fascinating shifting spectrum right now. So when functional medicine really sort of developed the name under Jeff Bland's leadership and David Jones and Joe Pizzorno and others, it was a clinician that was really experienced, that had been in the business for a long time. What we're seeing now, and it happened a little bit over COVID, but it was starting to happen before. What we're seeing now is that we have students that are actually in medical school that are asking the medical school to bring functional medicine into their school, which is ideal, right?
Great.
Of course.
If they're learning it in the moment as they're learning everything else, that's great. It's not a course, it's actually just a part of the fabric. Right, it's embedded in. So we are seeing more, early, just recently out and graduated and licensed practitioners today than ever before.
So that's your target audience. If you can get into schools, that's where you're spending a lot of your work, I'm sure.
Yes.
If you can get into the schooling, that's a big part of it.
I have a question about the time spent with the patient, right? So we're in a world where the average time doctor and patient is 6 minutes, something like that. Is it possible in that 6 minutes to have a functional medicine mindset and make a difference there, or is there some minimum amount of time a functional medicine practitioner needs to spend with their patient?
It is a great question. And it's one that we kind of battle ourselves on right now. 6 is tough. 15's a little easier. Anything more than that is, icing on the cake. When I started 8 years ago, we used to talk about a 4-hour first appointment.
Wow.
4 hours. I don't even have 4. I couldn't do that. No. I don't want to be alone with myself and someone else for 4 hours like that. No. We've moved to something that is shorter than that, but we are now teaching a piece of our program about functional medicine in 15 minutes. And that can happen, again, because it's a mindset, right? So much of what our practitioners are doing is simply asking some questions, hearing what the person's saying, and internalizing what that means and what the likelihood is that, if they're my favorite one. So we talk about sleep and so important, and then we say, and it's best to sleep in a dark room. We have all these things, right? Well, if you work a night shift, how does that work, right? We had to rewrite all of our literature around sleep to help people understand that sleep is just when your patient sleeps. You can't put qualifiers on it that it has to be all these really special things, because that's not how people live, right? So I think the notion that functional medicine can't be practiced in a shorter amount of time is going away. Certainly, if you have the time and energy and capacity and you can work your clients or your patients into that kind of a setup, it's obviously a completely different approach. If you have someone with multiple different chronic diseases, something they can't get rid of, it's going to take a little bit more time. But it can be practiced in a primary care setting. It can happen. We had a hospital that we've worked with for a number of years that was practicing nuggets of functional medicine in urgent care. It was my favorite thing. We asked them, what are the top 10 reasons that people come in? UTI was the top one. And they said, we see that same person all the time, right? And we brought in concepts that had to do with simply what's that person eating, what's their exercise, all of the things that we talk about. They started not seeing that patient again. Well, then the clinic's like, wait a minute, we want to see that patient. No, the reality is that patient goes out and says, I'm so much better. You should go to that clinic, right? So
it's
word
okay
of
to have
mouth
churn.
is powerful.
It's okay to have churn in the sick care world, people.
Yes.
They become promoters.
They become promoters.
Totally ambassadors for the process.
I guess speaking of that, where would you recommend for both, the clinicians and the individuals, if they're hearing about this, I suspect clinicians have heard about this before, but for a lot of listeners, laymen, they probably have. Where should they go as a starting point just to learn more about functional medicine and see if it's a fit for them?
Mm-hmm. Come to our website. We just launched a new website in December, actually, and I'm really proud of it. It's ifm.org, easy to get to. We have a health topics page there that kind of addresses a few things that people might be experiencing and why they might be interested in functional medicine. There's a page that defines what functional medicine is, what it might look like to see a functional medicine clinician, and this is probably the reason that people come to the page most of all. Find a practitioner page. We get more than 1 million hits to that page a year. Wow. And those are unique hits. So more than 1 million people. And all they're doing is searching by their zip code for a clinician that meets the needs that they have. They are, the people that are on that page have taken the foundational course, and they are members of IFM, which means they use our tools. And that's really a great place to get started if it's something that you're looking for.
And is your education still evolving? Like you mentioned this 1+6, and it was interesting to hear you talk about hormones and then environmental toxins. It's been a long time with my wife. We're always talking environmental toxins and we're trying to remove, but that in itself seems to be an evolving, area of education. So is is your courses just constantly evolving? You're constantly changing them? And adding or?
Well, so it's interesting. We have a requirement because we offer continuing medical education that we have to look at our education every 3 years, which is kind of funny because 3 years is a long time.
Yeah.
Right?
Yeah.
So we're required to do it for our status of being able to offer CME. We look at our programs every year. Even as we're doing online programming, which we record and it gets synthesized into a package of materials, we are able to input new material, new things that people need to know as a part of the program that we teach. But this is where the advanced learning that you mentioned comes into it, right? Because over the years, what we did is keep packing that material into our modules. And the modules got really big and even more cumbersome and harder for someone to digest. The transformation of our education now, which we're in the process of doing right now, we're about halfway through, we're kind of culling out the things that actually don't need to be in the module and then starting to produce the advanced learnings coming out of that. So anything that's new that needs to be in the program gets added. Anything that's new that's really advanced that we want anyone who has already taken the program to learn will be part of the new advanced learnings.
That makes sense. And we mentioned at the top of the show real briefly, we kind of look at functional medicine. Quite often I kind of see it as, you were talking about insurance, it's tough, and so how do you get it out to some of the people in different communities that can't afford it? How do you reach them? Like at the end of the day, we can all sit at this table and go, yeah, we saw a functional medicine doctor, but it's often cash pay and it's not affordable for most. How do you go about trying to reach the greater community on all of this?
So I was excited a number of years ago that we launched the Functional Medicine for All scholarships that the foundation's been helping and supporting. That the requirement is that you're working in an underserved community in order to get that scholarship. So you have to be working in a federally qualified community center or in a practice that's supporting an underserved community in order to be there. And when we start to look at the numbers of people that are being touched by functional medicine because of that program, I mean, we've had now 100, I might not get this exactly right, but somewhere around 100 people that have gone through that. And you start to just think about the number of hours that they practice and they're bringing to their community. And they're seeing a lot of patients a day. They're not seeing like 8 patients a day. They're seeing, 32 or 40 a day. That's our first greatest way to be getting it out there. We need to be doing so much more. So much more.
So I guess to your prior point, and Greg's question, the offering that you're mentioning is to bring more clinicians into the fold. But the other component of that is how do you provide functional medicine, care or that, scope of how to treat yourself with the help of a clinician. And I think some of the things you touched on earlier might be fitting for this cornerstone. It doesn't mean you have to order the most expensive tests. It may be things like nutritional literacy, just understanding basics like that. Is that kind of a cornerstone where you say, hey, if you're working in this served community that they don't have the luxury like we do around this table to go, yeah, I can cash pay for, give me a genetic test, a blood test every quarter, whatever that test is. It doesn't matter to me from a cost sensitivity standpoint. But in the community where they have that cost sensitivity, is there an understanding where you say, okay, here's how you can deliver this care, not with necessarily all the expensive items, but to a broader audience?
We actually make that part of the education that we teach. So we use the sort of choosing wisely notion. We are judicious labs, judicious supplement in terms of how we teach it. But we also have developed a set of somewhere in the order of 500 different patient education tools that anyone that's a member of IFM has access to use those tools and distribute them out to their patient population. And sort of stealing from my years in youth development, if you print something off for somebody and they bring it home and it lays on the kitchen counter, other people pick it up. You don't have have to have been in that appointment for that piece of paper to have meaning. Somebody reads
broader
it.
exposure.
It's super broad exposure. When I was in working with Big Brothers Big Sisters, and everybody started doing away with the newsletters, the paper newsletters that we would send to the families. It's like, do we have to do away with that? Because honestly, I knew that those newsletters laid on cabinets in work environments, and people read it and they learned about it and they decided it was time for them to become a mentor. The same thing happens with our materials.
Yeah. So. That's interesting. It just made me think about the digital world, because I had this exact experience you just mentioned this morning and last night. I have some things on the counter at home that's related to a local charity that does phenomenal work, and my wife picked it up and she was reading about it. So it was proof positive that happens daily. As we move more towards a digital world, I wonder, how much of that gets, lost in time.
I think it does get lost. We've had to sort of learn how we put things on social media. For a while, we would put something on social media and you had to read through all the dense content in order to get to, hey, you should sign up for a class. And just recently, in the last 2 years, we shifted that. And it felt sort of in your face, like, oh, take this program. But the reality is people are they're just scrolling. We know that. So you have to figure out how you're going to get them digitally. I'm a big fan of figuring out how you actually get them to hold a piece of paper once in a while, too.
Me too.
I like paper books.
Yeah.
So
I'm more of an audible person, but anyway.
So I have a question that, we didn't give you this in advance. So this is, guttural response for you to think about.
Oh, there you go.
So you sit at an interesting intersection of, very deep understanding from your childhood of conventional medicine and all the great things that you're doing at IFM. If you had to make a very bold prediction of how you would like to see or maybe expect to see healthcare evolve, if you look out 10 years, what does that bold image look like to you?
the bold image is actually that we're not calling functional medicine. And I don't want to use the term good medicine because I feel like it's overused, but that the basics of understanding root cause medicine are just how we're operating. It's just the standard, right? It should be what we want to know anyway. We should be having that conversation. I think the scary part of it is I'm not sure what happens around that. And what I mean by that is I think hospital systems right now have driven so much of healthcare. Highly technical exams drive a lot of healthcare. All of that is important, but focusing in on the data that's really important to help somebody take back their health has to be where we go, because if we expand it too far, we're going to cost ourselves out. And that's already happening, right? So it does, if I can, I could hook it to a little bit of what you're doing.
It's a nice transition.
If that's okay.
That wasn't intentional on my part. It wasn't intentional.
Yeah. What I think is so exciting about the data that you all are pulling is it provides support for functional medicine. I think just putting a lot of data into people's hands, though, is scary. And we know this firsthand. If, like, DNA testing, you can get those results and think, I'm doomed, right? Mm-hmm. Like, look at all these things that I'm gonna get. I'm gonna get it, right? It's not true that you're gonna get it. You know that's true from your data. We have to have more evidence to show that so that we can get out of the way of the journalists and others that want to kill the idea of root cause medicine. So where we need to go is where it becomes part of the way we are operating. If we cost ourselves out by too many tests and too many supplements, then we won't actually get there, because it makes us too vulnerable. If we can continue to get data like what you're talking about that actually shows that you can look backwards on someone's trajectory and understand what's gonna happen and how they might be able to address that, and do it in a way that isn't as costly, that's where we need to go.
So we have unified mission in the sense that education is critical, right, to evolve medicine and health and wellness in the way that we would all like to see. This is something that I think you could probably help us learn and perhaps work together. If you're focused on education for the clinicians, we'd like to help be a part of that, with clinicians and with the consumers, right? If we can get both of those parties to have more information, like you said, if we have lots of great new data and things that we can provide is super, but we need to have the education that go along with it.
Yeah.
Are there ideas, things that you would suggest, or things that you've said, hey, these have worked very well for us in the past, education-wise, or maybe things you'd like to do going forward?
Well, I'll do a little bit like what I did with the definition of functional medicine. We can't get too cute for ourselves, right? We have to be educating on what's true. And what I mean by that is we want to go to the immediate. So we can't teach to protocols for a particular disease state. We actually need to really be thinking about how did you get here, that root cause. The education needs to be focused on helping the clinician think, just simply helping them think. I heard this, I understand this, this is what the timeline shows me, this is what I think is happening for this patient, and then helping them engage, the education on how they engage with that patient in order to help the patient understand what's happening. We have to, there's an underlying education that needs to be there so the clinician doesn't just go to, oh, it's this, here's the protocol, we can fix it. And protocol is where everybody wants us to go. They keep asking us, can't you just give us a protocol for that? No, because your protocol and your protocol and your protocol, it's different than my protocol, right? So I think the way we get there is if we have to be delivering our education as efficiently and effectively and meet the learner where they are. We have to be doing it as cost effectively as we can, which is hard. I mean, that's hard. When we're serving a smaller number of people, the education is going to be more expensive. The faster we can grow that pool, it'll be less expensive. But the longer that we have people saying functional medicine isn't real, it's not science-based, there's no evidence to support it, that's bad. How does that happen? People get the wrong idea of what functional medicine is. It's a vicious cycle, and we have to be willing to cut into it. And that's I'm not very popular in the circles around sort of the practice implementation pieces sometimes, because we have to be honest about what is good and what is not, and what we need and what we don't need right now. And
it takes bold decisions in leadership, right?
It does. I'm not very popular a lot of the time. I'm not, and I'm okay with that.
That's okay, yeah.
Well, sometimes doing something different makes you unpopular, and we've been in the same boat, and might be currently, because I would say I love the way you articulated like your mission, which is very similar to ours, that for functional medicine to just be medicine, and I guess the way we put it is proactive medicine too, but it's very, very closely aligned, and certainly we're of course not functional medicine practitioners ourselves, but we want to be able to create the tools so that we can the tools and education so that functional medicine can work better. Like for example, trying to get how do you design a report so that the practitioner can understand the root of the problem in 30 seconds or less, and so it goes back to that time per patient. Maybe we help it go from 15 minutes down to 10 minutes. I know we don't want to get around the human interaction, which is very important, but also trying to meet some of the practical limitations that might help to make this more widespread.
I think you're exactly onto it. Yeah.
It's an interesting space because, and I've mentioned on this show before, it's like when you consider that healthcare is, we spend $4.5 trillion a year just in the US on healthcare. And 97% of that we've talked about is reactive medicine. And if you think about the incumbents in that, whether we're talking pharmaceutical, hospitals, doctors, the list goes on, insurance, everybody else, it's like they are probably not interested in churn in the sense of curing. Like you said, well, actually churn can work if they become promoters. So and I kind of like that analogy actually, but it is a tough uphill battle when you think if we have 3% of all that spend is on proactive, or 135 million if my math is right. 35 billion, did I say billion? Yeah. And so it is an uphill slope, but I like that you mentioned earlier that potentially and we've talked about it as well, is probably the best place to start is in the educational institutions, to align with them, to get this new generation of doctors and physicians and everybody that are coming out to actually be just, oh no, this is just normal, you know.
It's just normal. What's interesting and what we sometimes I think have to keep reminding ourselves is hospitals and institutions, the thing they want to do is differentiate their care from somebody else's. And so what we have seen more recently is that an institution will say, can you help us think about how functional medicine could differentiate us? And we're like, oh yes, we can.
Sure.
We are happy to help. When shall we meet? That it is true. And you get it comes back to then the patients become ambassadors. So it's just churn versus longevity. That person isn't going to go away. They just aren't going to come as often, right? But when they have the next thing, they're going to come back and want to talk to you about that thing too. And the reality is, we need conventional medicine to be as operating as effectively as it can. If I break my arm, or when my son broke his leg, when our son broke his leg, the care that we got in that hospital was off the charts good. Off the charts good. When he left the hospital, what we did was think about what we needed to do to make sure his healing happened as well as it possibly could. And without really, really great surgeons and really, really great trauma care, that the healing wouldn't even have been necessary. So we need it all. We need it all to be functioning and working in a cohesive way. Nobody needs to go away. We just need to be working better together.
That's really cool. I mean, I talk about my conversations with my wife, and she's very much, we were discussing at breakfast, she's all about a lot of natural medicine. She loves Barbara O'Neill. I think I just heard, she just got called the godmother, everybody's grandma or something. I saw on Instagram this morning. It was hilarious. It was great. And if you don't know Barbara O'Neill, you should look her up. She's an Australian woman that's preaching a lot of great, sort of just old school natural medicine ways that I think we've lost a generation of that. You know, we were talking about this morning how I put onions on my feet when I'm getting a head cold, or chopped up onions next to the bed, and it all feels, but I'm like, whoa, this stuff actually kind of works. Do you have a team in the Institute of Functional Medicine that are kind of going out and exploring these things, almost like skunk works? You know, you hear that expression in tech where it's like, go out and explore this thing. And do you have that where you're kind of saying, hey, we want to see if these things work? How do you determine what you're actually going to be educating people on?
So we have about 100 employees at IFM. We have 60 subject matter experts, and a growing number of those. And those are people who are actually delivering our education, but they're also the people that are practicing. They're the people that are going out and trying different things and seeing patients and seeing what is working. That's where we're getting the bulk of our information. We do have internal people that are foragers as well.
Foragers,
we call them foragers. We actually got a medical librarian, which is pretty exciting. Yeah. But I think we get a lot from the subject matter expertise that we bring in. We contract with a lot of people to bring in, the new ideas and the new way of thinking.
Very cool. Guys, any other questions? Otherwise, we're going to finish up with a couple of fun rapid fires here. We covered a lot. You've been amazing, by the way.
Yeah,
you came prepared. This is really great. Really enjoying this. So, at the end of each episode, we've been throwing in a thing where we do overrated, underrated, and we've explored a lot of things from cold plunging and saunas to all sorts of all sorts of different things. And we got a little bit of time here, so I'll throw a couple at it, and we can all go around the table, all right? If
Sure.
you guys are up for it. And these, Barry's helped me out with some of these, which I like. First one, favorite biohacking thing that you've tried. And biohacking for people, that can be things like cold plunging, it can be sauna, it can be, maybe you tried lion's mane mushroom teas, or there's there's tons of different things that we're all trying to see if we can get our brains to light up more, sleep better, exercise better. Amy, I'm going to put you on the spot. You want to hit us with one, or do you need a moment?
I need a moment.
Have you tried a lot of different biohacking things, would you say?
So, no.
No.
Okay. Well, I don't know if you want me to do this now.
Sure.
I can. I tend to be as few things as possible person.
That's not a bad strategy.
Yeah. I don't take any supplements.
None. Zero.
No, I don't.
Have you ever?
I have for very specific periods of time.
Yeah.
Healing from something, or but I don't, as a rule. I try to get my vitamin D through a daily walk, and
Yeah.
Good on you. I'm searching for
Yeah.
every marginal
Yeah.
gain I can.
Well, I will say though, and I don't know that you would consider, sort of clocking your steps of biohacking. It's light, right? It's light. But there is something to me that's energizing about the number of steps that I take a day. And what I love about it is I finally am getting my husband, David, to be interested in it as well. And so, we'll finish a walk together and he'll say, well, how many steps? How many steps do you think?
You're touching on an element that it's really foundational to what we're trying to do as a health company, which is measurement, right? And the gamification, which I think that term's overused now, but it's appropriate. The gamification of having something that you can look at, post doing it is such a rewarding experience, right? It's like immediate gratification or acknowledgement for something that you did.
Yeah.
So I think as much as we all understand that and appreciate it, I almost think it's still undervalued, like how influential that is. And we've had some similar experiences as a company. We've done step competitions. We do a lot of different competitions, and it's very rewarding and energizing, I think, for people, and it kind of brings people into to try something or become much more in tune with something that they haven't been in the past. So definitely agree that anything like that, whether it's steps or something else that you can monitor, is a very rewarding and beneficial experience.
By the way, those competitions he's talking about, they're always things that Barry can win at.
That's not true.
That's the way you set it up. I can win this one, not that one.
That reminds me.
How many burpees can we do?
I'm in a step competition right now, so if I take a few steps, I see it here.
Don't you talk? How long can we plank is the one that he wins.
A little tap in here.
Actually, David, you've got the planking and you've got the burpees. You guys are winning those all
Well,
the time.
we got to show the young people that us old guys can still do it.
I actually said to him last time before the last burpee competition, "You're going to take it easy on me?" He's like, "Hell no, I'm going to win this thing."
Always in competition. Always in competition.
I do actually admire that. I think it's great. I'm not going to take it light. Do you guys have one?
I thought you mentioned cold. You do cold plunging? Or no?
No, I only listened to the episode where you were talking about it.
Okay.
I hate being cold.
Okay.
I hate being cold.
No,
so I couldn't do it.
Okay, so no biohack. I mean, for me, top biohack is the cold plunge, and I call it a biohack because there's still, I'd say, a low level of evidence. So we're actually, but it's one of those things where I just feel so great that I'm sure it works on me, maybe not on everybody.
Right.
And we plan to actually do a study ourselves to see if we can get some solid evidence behind it.
I love it. I love it. Well, we talk about it a lot, actually. So yeah, I think there's power there.
So I know, like you said, Greg, biohacking is a pretty broad definition, right? It can mean a lot of things, so we don't want to offend anybody. Mine is meditation, which I just started doing in the last year. I've never done it prior to about a year ago, and I'm not great at it. My mind wanders a lot. I've got 7,000 things that these guys will tell you that I'm usually working on or thinking about. So it's not easy, but I'm finding it is improving my stress and other physiological benefits that I can see. So it's something that early in my process, but trying to do it daily for even if it's 5-10 minutes.
And we're trying to figure out how to track that within the Volo app and things as well, how you can actually see
whether your resting heart rate improves or other
Mine's similar to yours. Mine's in that mental performance type space as well, I guess. I'm calling it mental performance because I like that term, but it is more like going outside every morning, practicing gratitude, getting myself to neutral, I like to call it. I'm not trying to be positive. I just don't want to be negative. That negative spiral, I can go down pretty quick. You know, it's like, no, get myself back to neutral. And so that's been huge for me. So it's kind of similar space. It's a good one.
Well, on that, just for a second, can I just... So
you can.
You know, we have a gratitude journal that we make as a part of our toolkit. And I think those pieces where right now we think of it as a biohack, shouldn't that just be who we are as people?
Yeah.
Right? Like, what has happened that we have to call it a biohack?
But this is also when we talk about the future here, and especially when we look at a lot of the AI, different tools. And one of the things I kind of go, the big one at the top of the list of what life is about is like socialization and relationships for health, right? Harder to measure and that kind of thing. But for me, even just sitting with you three here in a room and having a chat, I feel energized, right? And it's like, this is the stuff that I get a lot of energy from. I think we all do. I often look at these podcast things as a bit of therapy, to be honest. It's like just somebody's going to listen to me for a moment. Like,
what do you want to talk about today?
Actually, can we bring it back to Greg for a moment? Anyway, let's move on. You've ruined my next question, which was what's the most underrated supplement? And you just said you don't even take supplements.
Well,
but
she has, though, for...
symptom
treatment and things. So
right,
maybe she has one. That's
all right. I shouldn't put words in her mouth. All
right. No.
Most underrated supplements, everybody.
Well, I don't know if I'd call it underrated because I think it gets talked about a lot, but vitamin D. I mean, I just, like, you can't go wrong, right?
I like it.
Stole my answer.
Sorry.
I'm going to repeat it because it's got probably the strongest evidence. It does increase your vitamin D level. Deficient vitamin D is tightly connected with.
How would you guys say you would take the supplement, though? Would you just take the supplement, or do you think being outside in the sun and getting it on your skin, like, do you differentiate?
We may have different answers. I'd say there's mixed research on how much sun you need. So some research says 10 minutes, and some research says...
Comes back to the individual, maybe.
Says an hour. And it may be individualized and how dark your skin is. But really, I think you dose the vitamin D or lack of, depending, based on a target vitamin D level, which we know is healthy. And we sort of see, level of 50-ish is sort of a healthy level, but not going so crazy, trying to push it up to 100 where we don't really know, if you can be too high. And then people need different levels of supplementation to get to that level. Some people it's 1,000 IU, some people it's 5,000. But I would look at more at the level, and if the sun can do that for you and get to that level, then you probably don't need a supplement.
Can I just do one more follow-up question? Have you noticed anything by taking any vitamin D, if you're taking 1,000, 5,000? Have you actually, we say vitamin D is the most underrated, but have you actually, when you take it, because this is the thing when we look at taking supplements, have you noticed anything when you take vitamin D?
So for me, no, I've never really been deficient. I had a level of 30, and with supplementation, I bring it up to about between 50 and 60. I do get sick less, but I've also done a number of other things, so I don't know if I could attribute that to vitamin D. In fact, I know I can't. There's just too many other healthy habits that I've fixed as well.
But you're basing yours on scientific research and...
Yeah, and when you sort of look at our own studies, it's sort of this curve of increasing risk once you get below 30. So really from 30 to 50, again, when you look at the outcomes, they're, it's very, very small improvement, maybe some if you're looking for every edge you can get, but going from 30 down to 20 is an increase in risk. Going from 20 down to 10 is a
This is a future deep dive, by the way.
Wow.
Right,
I want to do a deep dive episode.
love that.
And I by no means claim to be a vitamin D expert.
No, but we will be by the time we do the episode.
But I've said in other episodes, I take like 30 plus supplements.
Yeah.
But almost all of them have very thin research. So if people look at me and say, okay, he's healthy and so I want to copy his, all of his 30 supplements, I'd say that's like maybe 5 to 10% of my
you're
health,
exploring.
and there's maybe only 5 of those with strong evidence behind them, and the others maybe work. So it's sort of worth it to me to try, but it's really the other stuff that's more important.
Yeah.
N of one. You are N of one, right?
one.
That's
That's
the
right.
whole.
Yeah.
That's the
All
whole
N of one.
piece of it. Can I add one more
Yeah,
to
please.
mine?
Yeah,
First of all, I'll say I actually think for me, and saying I don't take it, I do. I walk a lot every day, and that walk, both the move, but actually just being out and being away from my desk and walking my dog. I feel like I'm getting so many different things in that. And
Well,
and
you're
the
not getting any vitamin D in Seattle. So. I'm just kidding.
harder for sure. Yeah. The other thing I would say underrated, and then I want to hear yours, is zinc.
Yeah.
So I mean that is my go-to. The minute I feel something, the minute something's coming on. And I have to say, I don't get sick very. Knock on wood. I will go home with something horrible. I'm sure. I mean, I probably will.
Take some
but
zinc today, just
Yeah,
in
I'm going to
case.
take a whole bunch.
I've got some in my office.
Yeah.
That's also one of my 5
Yeah.
with strong evidence.
Yeah.
I'd say.
Yeah.
Yeah.
I'd say zinc sort of. I mean, I think the whole vitamin C thing is, it's just there's just never been strong evidence, and people love it. But zinc has strong studies and evidence that it really does, prevent sickness.
So mine's magnesium, which I also started taking fairly recently.
Which magnesium?
Glycinate, about 6 months ago. And I don't sleep. Historically, I haven't slept more than 5.5, 6 hours. Not because I didn't want to. It just I wouldn't stay asleep that long, and mine would get going in the morning. Since I started taking this, I can pretty routinely sleep 7 hours, and I feel more refreshed. I'm starting to see some other potential benefits in things that we track. So, I have some crazy wild dreams too. I don't know how related
Magnesium
that is.
glycinate's insane.
Yeah.
Yeah, it's awesome.
Yeah, so I've enjoyed taking that.
Have you? By the way, I agree with all of them. Vitamin D, zinc, magnesium.
And the other thing I should say is the 5 with the strongest evidence are also the cheapest.
Yeah,
Ironically,
yeah.
it's those expensive new supplements that sort of longevity supplements come out.
Isn't that
have
fascinating?
very, very
Give
thin.
me your 5 real quick, just so listeners have.
Yeah, I hope so. It's the 3 mentioned here. So
Yep.
the D's, zinc, magnesium, I'd
Fish
say,
oil.
fish oil, and creatine.
Creatine. Yeah. I think they're kind of the 5. And to your point, the magnesium glycinate I used to take as an athlete. This year I went back on again. Amazing sleep, and I take a fair bit. Have you ever had what Laura and I terminated reversi, where you take the magnesium glycinate and boom, you're just wide awake?
No.
Oh, I've had it. I get it now.
Great. Now
and
I'm going to have that happen.
Tonight.
It's placebo.
Yeah.
No. But it's a fascinating one for me. And I've had it happen a few times where I'm like, oh, I'm just awake till midnight. Nothing on my mind, nothing. I'm in a good place. But I'm like, that was weird. I'm going to add another thing to all of these, heavily scientifically backed, all things that we like. But I'm actually, Laura has got me doing more and more homeopathic. And now I'm a cynical Australian male. I don't believe anything until I've tried it. And some of this stuff is really working. In fact, I've been going around the office when people get sick, the Knox foam, the hydratus when your nose is sick. It's called, this is how it's spelled, and maybe somebody's going to yell at me. It's called coffee, but it's kefir. But when I wake up in the middle of the night, like that 1 a.m. brain, you guys ever have that? I just take a couple of those and it seems to be working. I'm just throwing it out there as another, I don't know the scientific research, just throwing it out there. Some of this homeopathic stuff seems to be working. And I'm surprised. That's all. I'm like,
So it puts you back to sleep.
yeah,
Immediately.
these tiny little white pills, and you put them under your tongue, and something like I wake up at like 5 a.m.
Is that the only time you take this supplement? Is if you
those
wake up in the middle
homeopathic,
of
there's thousands of different types, but that one, then there's ones for anxiousness, there's ones for every kind of... The homeopathic, from what I understand, God, I'm really out of my lane here, but is really focused on symptoms. So if you have a symptom, it doesn't go to... Not like functional medicine, where it's like figuring out the cause. Like, look, you've got this issue, you're feeling like you're going to... remember I was playing around with nicotine patches there for a while, and I thought I was going to... I was so nauseous. I was so sick. And I took these Knox Farms, and 10 minutes later, I was fine. I was like, Could be placebo. I don't know the research, but it's just interesting. I'll keep you guys up to date on my journey into homeopathy.
I'm studying homeopathic for my dog, actually.
Oh.
So there's a whole field for dogs.
For animals as well.
Yeah. And the pellets actually work for him and different things. And Knox Fox is one of the things, actually.
Well,
There you go.
there's this whole world open up to
whole
us.
world, the pet industry and there's a new kind of functional medicine vet. We had a vet that went through our programs. Yeah.
Yeah.
Wow.
Well, here we go, guys. Well, Amy, before we wrap up, one final question. What gives you the most hope right now when it comes to the future of healthcare? I feel like sometimes we get a bit down, but what's hopeful?
You know, actually, the young clinicians coming through our programs, I mean, they are so, in many ways, they're not jaded. They're excited about being healers. They don't even, what's funny is we think they know the history of our organization and they know, they don't know anything about it. They heard about functional medicine, they heard about root cause medicine, and they want to know more. So just that desire to learn, to be able to do their profession as well as they can.
That's cool.
Yep.
All right. And finally, you mentioned your website. What's the web address, social media accounts? Where do we follow you and functional medicine?
So ifm.org for our web address. We do have Instagram and Facebook. FXMed is where you'll find us. And we're on Twitter too, I think, or formerly known as Twitter. X.
Everyone calls
X.
it Twitter.
Yes.
Yeah. Our generation is
Yeah.
Twitter. But
Yeah.
Anything else, guys, you want to ask Amy before
No,
she goes?
Amy, thank you so much for coming in.
thank
This
you.
was awesome.
Yeah.
Thank you.
We
for
really
having
appreciate you. This has been fantastic. So, and we're looking forward to potentially how we see Voloridge Health and the Institute of Functional Medicine potentially collaborating on things and really making a pass at changing the world. This would be really cool. Thanks
No,
again.
Thank you so much. It was really fun.
Cool.
Thank you.
Great.
Cheers.